So I'm a patient that has varicose veins, either unsightly or just restless legs, and I come to you. How are you going to treat me?
So we take a medical history and find out how these veins developed over what period of time and whether you have a family history of varicose veins, because those are all important things. And then the ultrasound scan or venous duplex scan is performed. And then based on that, we decide what treatment is appropriate. So if we find that you do have venous reflux, then that's a medical condition. And then generally those procedures are covered by the medical schemes in South Africa. And for those patients, we would do a procedure called an endovenous radiofrequency ablation. If you don't have venous reflux on the ultrasound scan, meaning your deeper veins are entirely healthy, then you would in all likelihood just require sclerotherapy, and that's more on the cosmetic side of things. And then generally those procedures are not covered by the medical schemes. So coming back to the endovenous radiofrequency ablation, this is a procedure that we do in the office under local anesthetic.
It's so nice that it's not invasive at all. You can just come straight into the practice.
Absolutely. So it's taken away the necessity to go to hospital or to have a general anesthetic. And these procedures on average take about half an hour to perform. So you're quite right in that you walk into the office, it takes about half an hour to do the procedure, and you're able to get up off the bed afterwards and walk out. Patients drive themselves home and they return to work the next day. So these newer procedures are all endovenous, which means that we work inside the vein, and all we require is a simple needle opening into the leg, into the vein, and we're able to do all the work through that single needle opening.
And then through the sonar guides you the whole way?
Correct. So the general conduct of the procedures that the patient would come in, we would give them a very light anti-anxiety tablet under the tongue just to settle their nerves for the morning, and they would lie down on a bed, and I would actually talk to the patients while we do this procedure. In the simplest terms, we insert a small needle around your knee, a small catheter or wire is passed inside the vein. We then inject local anesthetic around it. The catheter is activated, and by using heat, we seal that vein. And at the end, the catheter is removed from your leg. We apply a bandage to your leg, and you walk out.
And off you go. And it's not painful because of the local anesthetic. You might just feel a bit of tingling.
Correct, yeah. So I always tell patients the actual procedure is not painful at all because we've anesthetized the vein, but we still need to get that anesthetic into your leg. So apart from magic, we need to use needles to get it into your leg. So there are a few very small needle pricks on the inside of your leg. We're able to treat even the most needle-phobic patient by giving them an extra sedative during the procedure. So being awake is optional. If the patient does want a sedative during the procedure, we can most certainly do that.